Thank you very much, and welcome to everyone on the call. Very glad that you could join us today, and good morning, happy lunchtime, or good afternoon, depending on where in the country you're located and which time zone you're in. My name is Jennifer Zelmer, and I'll be the presenter for today's call. And just wanted to repeat a couple of things from the introductions as a reminder, and I see we've still got people joining now actively. So just as a reminder, today's call is being recorded so that we can share information with others. And if you're interested in asking questions at any point during the call, you can use the text box on the Q&A text box on the right-hand side of your WebEx screen, and we'll be monitoring that and try to respond to questions probably at the end of the call rather than during. Although if we see them popping up, we may try and respond as we go as well. The focus of today's call is on looking at patient online services for individual Canadians and the differences between what Canadians indicate they're interested in and what we currently have, and the opportunities for moving that ahead. So if we're going to look at that, we need to start with, well, what do people actually want? And sorry, I haven't been flipping through the slides as I've been giving you notices along the way about things like recording. So I'll just do that quickly and then get to what do Canadians actually want. So there are 5 things that come way above all of the other possible options when we survey Canadians about the functions that you're interested in. And you can see 4 on this screen. So people indicate that they're interested in e-visits or being able to communicate with their healthcare providers, most often expressed as, I just want to be able to email my doctor. Second, they want to be able to view their own health information with particular sweet spots for different groups in the population. So for example, individuals with chronic conditions often want to be able to view lab test results. Parents often want to be able to view things like immunizations for their children. And there are other particular areas depending on your individual health needs that may be of interest. The third area that is highly ranked by Canadians as a function they're likely to use is the ability to manage medication refills and renewals, or request those online. And last but certainly not least from this list of 4, people are interested in the ability to be able to book appointments with healthcare providers, most often described as, I would really, really like to be able to book an appointment without having to call in and wait on the phone to do so. Now, you will have noticed at the beginning that I said there was 5 things that people wanted, and there's 4 on this screen. So what's the 5th thing? It's being able to do these 4 things on behalf of others in your life. And as you can see from the next slide, the proportion of individuals who say that they would be likely to use these functions is quite high. It's 8 in 10 or higher are interested in using each of these functions. So if people are interested in using these functions, we also wanted to understand what value they expect to get from that use. And so the following slide looks at responses to surveys in terms of their expected benefits. And you can see a cluster at the top, many of the most common reasons being about access. Make this easy, convenient for me so that I don't have to take time off work to go into an appointment for a simple question, for example. When we do qualitative work, that's often what people say, sort of in explaining their interest in access and convenience. They also talk about the fact that this would make interacting with multiple healthcare providers better and easier. So particularly for individuals who may be interacting with different healthcare teams because of different conditions they may have, they're interested in facilitating that interaction and making sure they have all of the information from all of the different providers that they're in touch with. Third, helping keep them and make them more informed about their own health and the health of those they're caregivers for. So being able to be an active partner in their care and to be able to engage. So we often hear people say things like, well, I'd really like to be a part, but I need the information and the knowledge to be able to do that. And that includes the information about their own health and health conditions. And the 4th in that block, making the healthcare system more efficient. So in focus groups, people will often talk about the fact that, well, I know that I'm taking up time in a busy schedule for a simple prescription renewal. Things like that they're concerned about and have a desire to make the healthcare system more efficient so that there can be time released to care for those who need it the most on a face-to-face basis. And you can see there's a number of other aspects and benefits that people are also interested in and expect to see from consumer health solutions. And if you add it all up, particularly if you focus on that last point that I discussed of making the healthcare system more efficient, the conference board looked overall and used survey data that asked people, could you have avoided your last consultation with your physician if you'd been able to do secure messaging, access test results online, and renew prescriptions electronically? And about half said that they could have. And the conference board translated this into an equivalent of nearly 47 million fewer in-person visits to healthcare providers, a significant chunk of time, 18.8 million fewer hours taken off work, and an even higher amount that would be released for non-paid activities, whether it was education, going to school, volunteer time, leisure with friends and family, and so on. So the potential impact that Canadians see is quite significant from these types of services. So if that's the desire end of the question, where are we today? Well, more than 8 in 10 want access, for example, to their own health information online, but only about 4% of Canadians actually have accessed that information. So there's a significant gap between those two numbers, not just for access to your own health information online, but actually a similar kind of gap for the other services that we talked about earlier. And as we think about that, it's interesting to compare our situation with that in other countries. So this next slide looks at the results for 7 different countries. Because it's international data, the latest data available was 2012, but compares to the results for 2006 in terms of whether or not patients in primary care practices could email their family doctor. And as you can see, in all of the countries that were involved in this survey, there's been significant growth over that period of time, but equally in all of the countries here, less than half of practices currently offer that ability. And so there continues to be significant room for growth in all of the countries included in the survey. So if that's the case, I think it's also interesting, though, to understand the perspectives and learn from those who have dipped their toes into this water. What do we know from those who've moved forward, both in terms of the examples in Canada and internationally? But I'd like to start with a couple of the Canadian examples. We're very fortunate to have had the opportunity to talk to a number of individuals who've had personal experience. Some of you on the phone may have heard my own personal experiences. I've had the luxury of having some of these services myself, and certainly both in terms of convenience and in terms of the way that my care was facilitated by these kinds of tools. It's been a real boon for me. But even more important, for the individuals who we've connected with who have more significant health issues. So for Alexa in Halifax, for example, she talks about the degree to which having access to her own health information, being able to communicate with her healthcare team, and being to share that information with those who she wishes to share it with, has empowered her to make a difference in her own health. She talks about the fact that, absent information, there's a big gap in knowledge and understanding, but having that information helps to make a better conversation with her healthcare team and to allow her to have a different style of care and a different style of communication as well. Judith talks about the fact that she had a very complicated cancer journey, and fortunately was at the stage where she had come through much of that journey and was taking a trip to Mexico for a holiday. And on that flight had significant pain, such that they actually had to do an emergency landing and get her to a healthcare facility straight away. And her healthcare team in Mexico didn't have access immediately to her records back in Toronto, and so they were proceeding down a path of thinking, she might need emergency surgery. Judith was able to pull up her patient portal access to her hospital records, share that with her Mexican healthcare team, get that connection going, and as a result, a different course of action happened, which was obviously much better for her and much better for her health in the long term. and so on. So Cheryl, for instance, talks about the benefits for her daughter and her care, very complex care situation, the need to bring together information from all sorts of different sources and maintain that connection and maintain that integrated plan of care as she moves forward. And we see that both in terms of these broad kinds of solutions and also in terms of very specific ones. So we've also done some work looking very directly at e-booking, for instance, a set of research that was done in Quebec and some additional work with early adopter practices across the country found that no-shows, for example, were cut in about half as one of the benefits for practices, that it was quicker for staff to do appointment booking, and they were able to spend their time on what they considered to be more meaningful services for patients. So outreach, for example, for proactive prevention services or follow-up. And patients reported huge benefits. There was absolutely the convenience benefit. There was also a much better patient experience, so there was a satisfaction benefit. And they also appreciated the reminders and alerts that were built in and helped to make sure that they were able to continue to be an active participant in their own care. At a more complex issue, an example from here in Ontario supported patients on the pre-diagnosis part of their cancer journey, so from the time of significant symptoms through to diagnosis. And as you can see from the quote on this screen, for many individuals, this is a really tough time in their lives. This is a time when lots of information is coming at them. They're trying to understand, their families are trying to understand what's happening in that process and what their journey might look like. And so, they talk about the fact that there's a lot going on in your brain. And these kinds of tools help them to understand their health problems and help them to improve their knowledge about their health in a time when they're facing some very difficult and complicated decisions. If I move across the country again to Nova Scotia, a patient portal project there that connected patients in with their family healthcare teams. 3/4 of individuals involved said that they felt more involved with their healthcare because of the personal health record, and half said that they'd seen a change in how they were able to manage their own health a lot, and another 35% said that they'd seen a bit of a change, which over a relatively short period of time for many individuals would be very healthy in this particular practice situation, I think is quite impressive in terms of the results that they've seen. So we've got some promising results from particular projects that are occurring in different parts of the area, and we also see from surveys across the country that individuals are reporting that not just in theory would they be able to avoid in-person visits, but that actually in practice they've been able to do so. So the results that you see on your screen now come from a survey of adults and focuses on those who actually used consumer health solutions in the past year. You can see here almost 2/3 of those who used solutions for e-requesting a prescription renewal said that they'd been able to avoid an in-person visit. More than half of those who'd done an e-consult said the same, and almost half of those who said they had access to medical records or part of medical records like lab test results. So we're starting to see in a Canadian context some of these examples of how patients and healthcare providers are experiencing the use of consumer health solutions. But as you saw in the beginning, those are the early adopters. And so if we're asking the question about how can these benefits be made available to a much broader group of our population, not just the lucky ones who happen to be in the locations that have moved forward as early adopters, I think there's some questions to ask and some lessons to learn from those who have been down this path already. And so some of the questions, I've focused in for the rest of this presentation on some of the questions I most often get when I'm talking to people who are either early in their journey with the use of consumer health solutions or who are maybe just starting and just thinking about whether this is something that would make sense in their context. The first one, and it's the first question that we really need to ask for so many interventions in the health system. So what is the effect on health or on healthcare quality? It's really that basic question, the first do no harm principle, and the what does this add in terms of the benefits for the health system broadly. The link that I tweeted out earlier includes a series of references on this front for those of you who are interested in delving into this further. But to give you a sense of some of the kinds of things that have been published in the literature and they're starting to emerge, is looking at the evidence of the effect on consumer health solutions in a variety of different contexts, often studied for particular patient populations, so for instance, people with diabetes or those with cancer. But sometimes, as in the first case that I want to talk about, a broader use at Kaiser Permanente. So Kaiser Permanente in the U.S. has now been implementing consumer health solutions and using them for a number of years. And they have, it depends a little bit on how you count, but about half of their patient touches, they call them, interactions with patients are now virtual. A little bit less in some areas, a little bit more in others, balancing out. They've looked both at some specific types of conditions. So, for example, a study published in 2010, they found improvements in the effectiveness of care for diabetes and hypertension. But they've also looked broadly and seen improvements in patient satisfaction, in access, in other benefits. And it's this kind of study, along with others from other contexts, that were included in a systematic review that was published in 2012 but included data up to 2010 that found moderate strength evidence for improvements in both patient satisfaction and glucose outcomes for individuals with diabetes, as well as promising but lower strength, there have just been fewer studies done, evidence for supporting adherence to recommended care in general or to outcomes for a number of other conditions. And a very similar report that was done by Canada about the same time, very similar type of promising results, but also a call for further research. So 2010, the cutoff point for those studies is now a couple of years ago. The world has moved on. There has been much research underway. And again, the links that I tweeted out earlier have a series of references to those more specific studies. But you see in those that when carefully designed, there's been demonstration of improvements in care on a number of fronts, including, for example, at the Mayo Clinic, where they looked at an issue around, were people using email for the right things? So there's always a concern that somebody will email, I think I am having a heart attack, send help now. And what the Mayo Clinic found is that's not how patients were using the service. So they found that about 3.5% of communications discussed potentially high-risk symptoms, but many in the context of ongoing conversations of care, and there were no deaths within the 30 days following messages related to the exchanges. And overall, their conclusion of the authors was that the message responses did not appear to have major safety concerns. So that's obviously an important starting point in terms of analysis, an important starting point in terms of safety, the foundation. And I think there's an ongoing opportunity to continue to learn from the experiences of those who are implementing consumer health solutions about how can we improve health even further using these. So how can we make sure it's not just as good as the current solution, but in some cases even better at improving health and improving health care. The second set of questions that I'm often asked is about, is the use of consumer health solutions fair? So many people are worried about the potential impact of access for individuals who may not have a computer, who may not have a smartphone, who may have other barriers in terms of the use of these types of solutions. On the other hand, you have individuals who say, well, actually, it's exactly the people who can't afford to take time off work to go into an appointment who can most benefit. And there are ways of reaching out through things like text messaging in low-income countries that have been shown to be very effective. So can we take some of those lessons learned and apply them here to reach potentially hard-to-reach populations? So there are some who argue these solutions may even be pro-equity in terms of their ability to reach populations that are challenging in other contexts. So what do we find when we actually go into the data and the literature? In Canada, surveys suggest that currently the availability and use of consumer health solutions is quite similar across income levels. varies much more in terms of geography. So for example, certain provinces that have moved forward with provincial-wide approaches than it does in terms of income for patients. For more complex solutions, we see things as in the Kaiser example, where they've actually studied patients with diabetes who were taking statins and found, interestingly, that those with inadequate health literacy and those who were married, I'm not entirely sure what that relationship is, were more likely to use a patient portal to refill their medications. And there was no significant difference in that case in participation rates by education level or for those with limited proficiency in English. Clearly, though, something that's important to take into account in terms of the design of consumer health solutions, in terms of how patients may be invited to use these solutions, how individuals are supported in terms of access as well. The third set of questions that I often get are around effects on workload and effects on efficiency. And these questions often come from very, very busy healthcare providers whose day is already chock-a-block with lots of other demands on their time. And they're worried about, how do I carve out time for what could be a swamp of emails or a swamp of other information that may be coming in to me. Now, it's easiest to assess the workload effects for more streamlined solutions like e-booking. Simple solutions, it's very clear. And in that case, implemented well, they've been shown to increase staff efficiency, the efficiency of appointment booking, and also in some cases to increase access to care, because patients have been able to access appointments where somebody's canceled in a way that might not have been possible in another environment. Particularly important in cases where appointment times may be quite long. So for instance, in some mental health consultations where there may be blocks of times that are reserved for appointments, and so a canceled appointment has a significant impact on access. For more complex consumer health solutions, the results are a bit more nuanced. And I think the real information there is that strong and careful change management is needed to optimize efficiency. What does that mean? It means thought about, how does this fit into workflow? Thought about, how does this fit in with the other processes that are going on in a busy care environment? And about how patients can be supported to use these kinds of solutions in the most efficient way. So for example, I was speaking with a physician recently in a context where all of their patients have access to test results online, and he was saying he'd actually changed the way that he talks about lab tests before they're ordered. So previously, he would discuss the meaning of the test after the results came back. Obviously, there would be a discussion up front in terms of why are you going for this test, but not in terms of what a particular result might mean. Now what he's much more likely to do is say, so here's the reason for the test. If the result is in this range, here's the kind of things that we'll do. If the result is in this range, all is well, there's this kind of follow-up, and so on. So that as a patient sees that test result, they know when they need to come back for a consultation and when they may not. Obviously, there's always the option for asking additional questions and so on, but he's found that change in his practice pattern to be quite effective in terms of improving the ways that he's able to interact with patients and support them in their care journey. Particularly important in contexts like his, where many of his patients have long travel times to come in to see him. And so he's very conscious of the fact that, a short appointment to tell you that your lab test result was normal may mean an 8-hour block of time for somebody who's got a long drive, time off work, and so on, that may be very complicated in their lives. So the fourth area that I'm often asked about, I often get questions about patient access to health information. What information, in what context, under what circumstances, those kind of things. This is an area where the Supreme Court of Canada has actually been quite clear. In 1992, they confirmed the right of patients to be able to access their personal health information with very few exceptions. So that basic context and that basic well, legal advice, I guess, provides a firm foundation for moving forward. As this happens in practice, there are questions still that are being raised about the how and about the what. So, for example, you see different results in terms of the implementation. Can patients access lab test results straight away, for instance, or is there a time delay on the access to those results? Are there portions of the record that are available online, or is it a full record? And the experiences in Canada as well as elsewhere seem to be, and we've seen this documented in a variety of studies, that up front there's definitely some trepidation. There are some concerns about what the impact will be. Will this have an effect on patients' anxiety, for instance? Will this lead to more questions, more worry? But after there's experience with the use of these solutions, they really seem to both improve the patient-provider relationship and be supported by clinicians. So in the Open Notes trial, it was published in 2012, for example, from the US, 85 to 91% of physicians who participated afterwards, depending on which clinic they were from, said that enabling patients to access their health records, including the full notes, was a good idea, and nobody withdrew from the service. So I think those are some of the interesting experiences that are helpful for us to understand and be able to share from those who may be down the path a little bit further than others and be able to help with the context for these types of implementations. And that really brings me to a set of questions around how ready are we for change? Because there's no question this is a big change. This is not just a change in terms of, it seems simple, something like secure email. We use secure email in many other aspects of our lives, and technically it's not that complex. But in practice, as we implement in a healthcare context, there are many, many strands that go into these decisions. So if we take secure email, for example, the need to make sure that that secure email is going to the right provider. That the provider, when communicating back with the patient, has the appropriate privacy and security in place to be able to do that. There's been questions about, so how do we ensure that the right information is provided to be able to understand the use of the service? So to be able to understand what the expectations are for the speed of a response, for instance, to a particular message, or who will be responding. Is it that person's direct primary care provider, or is it a team-based response? And many of the issues that actually come up aren't new. But these are questions that resurface as new approaches, new ways, new technologies are introduced. And we're seeing increasingly regulatory colleges and others grappling with some of these issues. So for instance, there's guidance, for example, recently updated from the CMPA, the Canadian Medical Protective Association, on the use of email to communicate with patients. The Canadian Medical Association, at its General Council this past summer, passed a resolution supporting secure communication mechanisms for secure communication between patients and providers. And there's been increasing discussion in the privacy community as well. So, for example, the BC Privacy Commissioner issued a statement indicating that they felt that patient access to information was important and that this is something that the health sector should facilitate as part of its role. So some of those various pieces are now coming into place as use becomes more common and as there's a desire for some clarity in terms of the environment in which consumer health solutions are being used. And at the end of the day, I think there's a very telling example recently from Alberta that talks about why it matters to work through these issues. For those of you who've had the benefit of hearing David Price talk about his son's Greg's story, you will know that Greg was a young man who was very active in his community, very engaged with his family, had a lot of things going on at work, and had some symptoms that initially he wasn't that concerned about and gradually became more concerned over time. Went through a very complicated care journey that had a number of breaks in that journey that caused problems with the continuity of his care and delays in that care. And in the end, Greg unfortunately passed away. And the Health Quality Council of Alberta, with obviously his family's permission, used Greg's story to understand that journey and to understand continuity of care and what was appropriate and helpful to improve continuity of care. And among other things, they talked about the importance of patients having access to their own information, of patients knowing what was coming next in their care journey, knowing who they could contact if they had questions, how to close any gaps that they may identify, and how to be empowered in their journey as an individual who needed high-quality care. And at the end of the day, that's what this is about. It's about how we can leverage new technologies, new approaches to improve healthcare for all of us. And if you think back and circle back to the beginning of this presentation to what Canadians said they wanted from consumer health solutions, I think you can see that we're really circling back to where we started, because it's exactly those kinds of benefits that Canadians indicated that they saw from the use of consumer health solutions. So I'll just end on this quote, because I think, although it was said in a very different context, it relates to where we are today. It's not the end, so much more to do. It's not even the beginning of the end, but it is perhaps the end of the beginning. We do have some experiences from early adopters now to draw on. There are plans in place in a number of parts of the country to move this forward. We do have active patients across the country who are speaking about their experiences and who are speaking about the differences that this has made in their lives, and healthcare providers who they've worked with in their care journey who are doing the same. As you start thinking about questions that you wish to ask as part of today's call, I've just included on this last slide some links for more information. So the international data that I mentioned to you comes from the Commonwealth Fund, and so that's the first link that's included on this slide. If you're interested in more information about the patient stories, experiences, and provider stories and experiences, you can find a number of resources in that regard at betterhealthtogether.ca, where you can access information, videos, other information, and so on. In addition, on Infoway's main website, so www.infoway.ca, you'll see a number of additional resources there, some of the benefits evaluation studies that I cited, for instance, a good deal of information about our active e-booking investment program that's open right now. So we're inviting physicians and nurse practitioners who deliver services across the country to join with us and be supported in offering patient e-booking in their practices. And also other information in terms of what's happening across the country, our active projects, and so on. In addition, there was an issue published this summer of Healthcare Papers, the Journal Healthcare Papers, that focused exactly on this issue and included both an opening commentary and then a series of responses from a variety of folks across the country. The links are really long, so I haven't included them on the screen because retyping them would be painful for all of you, but I've tweeted them out through my account today, so if you're interested in those links, you can access them that way, or through the resources page on the Infoway website as well. There's a link there to the healthcare papers issue. So that concludes the formal presentation, and I would be happy to take any questions that you might have. Whether you live in Canada or we've now received messages from people who are in other countries who are on the phone call today, so welcome to you. I didn't welcome our international participants earlier. And just as a reminder for those of you who wish to ask questions, you can do so in the Q&A box that you'll find at the bottom right-hand side of your screen. And we will try and answer any of the questions that we receive during today's call. Where there are similar questions, and there are some common themes that are emerging, I can see. So where there are some similar questions, we may group those questions together to be able to provide responses. So on that front, I will scroll down to the next set of questions. So the next set of questions relate to some of the data that I mentioned from the Canadian experience. And so they related to what we know about what's happening in Canada today and the results that were available from the surveys. So these were national population-based surveys that were undertaken among adults across the country. And the specific data that were being quoted are actually in the tables in that healthcare papers issue, if you're interested in them. So that looks at, for example, those numbers that I showed right at the beginning in terms of percent who desired specific solutions, as well as additional data that I didn't cite in the course of today's conversation, which is things like the percent who selected particular solutions as the most valued services, how Canada compares to other countries in terms of the availability of some of these types of services, and a little bit more detail on the data that I also cited in terms of what people report in terms of the percentage of times they were able to avoid visits. So hopefully that information will be helpful. If you have further questions, there is additional data available, and don't hesitate to get in touch, and we'd be happy to do what we can. I see the next set of questions coming up. And here we have a question about some of the experiences across the country and how to learn more about what's happening in different parts of the country. And so for those of you who are interested in the Nova Scotia experience, you will find at betterhealthtogether.ca videos from Alexa, who has had access to that service, and about her experiences. But you'll also find information on our main website, infoway.ca, with the evaluation of that service. So for those of you who are interested in that information, you're more than welcome to go there. That includes things like not only their experiences with the actual outcomes, but also the approach they took and the change management solutions they used, which I think all of those who've been involved in working with us on consumer health solutions would say has been really, really important. And they've valued the time that they spent in working through how to fit this in with workflow, how to make it work for patients and providers. And so the question that just came up in terms of a framework for consumer health adoption fits in with that. And so what we found actually in the projects that we've been working with is that the change management framework, which you'll find available on Infoway's website under our Programs and Services tab, has actually worked quite well for the consumer health projects. Obviously, the specific audiences and the specific approaches that might be used are a bit different, but the basic areas that need to be looked at and some of the tools to help develop adoption strategies and approaches have proved to be quite helpful. We have also done some specific work around e-booking. So there are some specific resources that are available through the e-booking section of our website that provide more information in that regard. So I'm guessing that that's what the question was about. But I should also mention that we do also have a framework for measuring consumer health adoption. And so you'll see that we're focusing on the areas that consumers indicate they have most interest in terms of tracking results over time in terms of their use. And you'll find those data in our annual report and elsewhere. But we also have what we call a system in use survey, which is a tool that helps projects to understand the perspectives of their users, whether in this case they're consumers or in other cases they may be clinicians or administrators within the practice. And that has also been adapted for use in consumer health solutions and has, I think, provided a helpful tool, and again is available if anyone is interested in using that. So slight pause as I read down the next set. So big question, yes, I agree with this question. How do we target, sorry, I agree with all the questions, they're all good, but this one I think is one that helps us to think a little bit differently about consumer health solutions. And this question looks at how do we support the 5%, those who have the most complicated care trajectories. And in different provinces, the percentage level has been set differently. So some places they're focusing on 2, some 5, some 10, but the underlying question I think is the same. For those with the most complex health conditions, how do we support them with consumer health solutions? From a couple of fronts, first question, which isn't exactly the question that was asked, but I'm going to add it in anyway, is in some cases there may actually be additional solutions that may be very helpful to them. So remote patient monitoring, for instance, shown to be very effective, for instance, for individuals with congestive heart failure, with chronic lung disease, in helping them to learn to self-manage their conditions so that they are staying out of hospital and staying out of other types of care services because they're well and home and able to manage their condition in their community. And those types of solutions tend to connect individuals with a care team, include a coaching and mentoring wraparound, and a number of other services as well to help people move through that journey. Similar solutions often used at post-discharge, those kind of things. So there's a set of solutions that may be quite helpful. But the guts of the question that was really asked here is, how do we make sure we don't end up, because you've got 10 healthcare providers with 10 portals and 10 passwords and 10 logins and, you know, silos of information at the consumer side? And I think that's a critical question. And I think there's a variety of approaches that people are taking to solving that problem. One approach that's being taken in Alberta, for instance, is having a common portal. And they sometimes describe it as a mall with many stores in the mall. So there's a single entry point, but then if you're a cancer patient, you can access the cancer-specific resources within that. If you need to register your organ donation preferences, you can also do that there. And there's a variety of services available within one context that allow you to access them seamlessly with single sign-on and so on. Another approach that has been taken is to say, this information at the end of the day is the patient's. And it's actually the patient who's got the best ability to cross silos because they do already right now in reality. They're dealing with different types of providers and different parts of the health system. And so being able to extract information and consolidate it in a patient portal. So that may not be the same patient portal for all providers, but their ability on a standards basis to import information from a variety of locations and have it all in one place in a way that makes sense. And then as in a number of the consumer health solution projects that exist right now, they also have the option to share that information with who they wish, including care providers. So as in the example I mentioned with the person who landed in Mexico, you know, she was able to share that information with her healthcare providers there, even though there wasn't a structural organizational relationship between the Mexican clinicians and the place where she was receiving care back in Toronto. She was able, through the use of digital health solutions, to be that bridge. To make either of those options work takes thought, and that brings us back to the change management approach. And I think it is critically important that we have a strong voice of patients and those who aren't patients but maybe someday, involved in the discussions around planning. So that's one thing that we require as part of any of the investments that we do at Infoway, for example, because there's no voice more powerful than those who have the experience, and they know that they have 8 different providers, for example, and so that it's important for them that this comes together. And having that information front and center then can influence the design process and influence also the process in terms of rollout and use in a clinical context as well. So I hope that's helpful in terms of the answer to that question. I see one more question now that I'll address, and then we'll see where we go from there. So the last question was just in terms of how to get more information on other international experiences that have happened outside of Canada, because indeed there is more happening in other parts of the world. There are things that we have to share with others, and there are things that we can definitely learn from others. And there's a couple of different sources that may be helpful. One is indeed to hark back to those same papers, the papers that I mentioned, which have references to a number of initiatives in the US, in Europe, and elsewhere that may be useful starting points. But also the links that I had up, I'll just go back to that slide, to the Commonwealth Fund. If you go there, they have a number of white papers and summaries of practice experiences from other countries in the world that may also be useful. So with that, I will draw this webinar to a close, and thank you all very much for having participated in today's call, for sharing your questions, and hopefully we can continue this conversation through Twitter, through other means. So we have tweeted out the links to those papers through my account if you're interested in accessing them. If you're interested in following up on the conversation, look forward to doing that there as well. So once again, thank you very much for your participation today, and I will now draw this call officially to a close.